episode of the Becky and Boca Show was recorded aboard this gorgeous yacht in the marina at the Boca Raton Resort and Club. I have dermatologist Dr. Green, and he's going to tell us about his practice. He is in Deerfield, and he has a beautiful, beautiful building there. And he's a dermatologist. He does cosmetic and regular dermatology. Sit right here.
Thank you very much for having me,
You're
Becky.
drinking water, huh?
Yeah, I'm not partying with the rest of them yet.
What do you think of the yacht?
I think the yacht's beautiful. I can't wait to come for a trip to Cuba.
Yeah, right. I want to go to Cuba. Yeah, we got to talk about you taking us to Cuba. So I invited you here on my show to tell us about your practice because you're relatively new to this area, but you've been in South Florida for how long?
I've been practicing for closing on 12 years, and I was in Fort Lauderdale for 11, and I just opened up here in Deerfield Beach 3 months ago.
Okay, and I've seen your offices. They're absolutely gorgeous.
Thank you very much.
And Deerfield Beach is very close to Boca Raton, so anybody in Boca can certainly go to Deerfield for their treatments. And you have a slogan.
So I opened up close to Boca with the idea of providing Boca style without the Boca price. And our whole goal was to cater to anyone who comes through the door will be treated like family and treated with quality care. We figured we could offer everything that Boca does, but just a little discounted price.
So go to Deerfield and he's going to give you a little better deal than you might get in Boca. That happens all the time. Bye-bye, Bobby. Bye-bye. That happens all the time. You know, I'll drive out of Boca Raton to get a little better price on something. So you kind of can do that as your little...
I'm only 5 minutes from here. It took me 5 minutes to get right over here.
Close. It's very, very close because we're in South Boca right now. Okay, what's unique about your practice that sets you apart from other dermatologists?
So one of the things that we decided to do was get some things to make us different. And in that regard, we came up with, there's a machine that we got called a superficial radiotherapy, or SRT for short. And it's an option I can provide to patients that can get rid of skin cancer without cutting, without scarring, without pain, and without any downtime, which is pretty amazing. I still do surgery, we still do Mohs. However, this is an option that people are given now that they can get rid of their cancer without having a scar. It's amazing.
And you showed me the machine.
Yes.
So you just come in for, it's like a few seconds,
Each
right?
treatment is only 25 to 30 seconds long. You have to do several treatments, but you get rid of your cancer, and it's a simple thing. You come in, say hello. It's like a date. You know, you come in and then you go get coffee, get lunch, and you're out the door. I mean,
so it's an alternative to the Mohs surgery.
It's an amazing alternative, yes.
And you get a much better result.
Cancer's gone, no scar at all.
And how does it measure that the cancer is gone?
The cancer starts shrinking, then you can tell after the last couple treatments there's nothing there.
That's amazing.
Yes,
okay.
absolutely.
So you offer that, but you also do a lot of cosmetic things too.
So I do everything from general dermatology to cosmetic dermatology, and we try to stay on the cutting edge of procedures. We offer lasers. We have new procedures like Kybella. We're using actually Kybella.
That's hot right now.
Which is one of the
Everybody's
hottest
talking about
items. We're using that even off-label.
I was reading about that. So you can take fat like in somebody's arm and dissolve it with Kybella?
So Kybella is a FDA product that's FDA approved for submental fat, which means underneath the chin, for the double chin. And it's a great option because people for years are saying, what can I do about my double chin? Well, now there's a tiny we inject in there. It's being tested for off-label usages. For example, bra fat, for lower abdomen, for the little tummy that people get. You know, after some women, I have a patient who's being treated after having her C-section scar, that she's a little bit of a tummy right above it. We can inject under there.
So
love handles.
Does it kind of do the same thing as liposuction?
Except you're not having permanent scarring from the trochanter. There's no surgery, there's no stitching, and it's just injections that cause the fat to actually melt away.
That's amazing.
Yes.
And can it be done on large areas? I mean, the chin's very small, but I mean, if you had a big...
It depends on the area, it depends on the person, but yes, this does work. And it can be on any area there's fat.
Wow.
Yeah.
That's very interesting. Okay, what are the newest and hottest treatments that people aren't really aware of yet? Because I want some breaking news here.
So we already talked about one, which was Kybella.
Right.
Another one is, everybody does fillers, and I do a whole bunch of fillers. However, there's a new one that's considered a semi-permanent filler.
It's not silicone, is it?
No, it's not silicone. It's actually called Belafil. Belafil is an old product that they actually remarketed and changed the molecules in there. And it's these little micro beads that actually build collagen. They stimulate collagen growth. The concept is most fillers last anywhere from 6 months to a year. This product lasts 3 to 5 years, and the company is promoting 5 years. I still say 3 to 5 years, so it's semi-permanent. So you're not having to repay every single year for more fillers.
I would think that would be very interesting to people. But so it does disappear eventually?
After 3 to 5 years, it actually the body then reabsorbs it.
And you say it's a little.
It's hyaluronic acid mixed with these little micro beads that actually stimulate collagen growth. I actually don't know offhand. It's like a long it's a long name, but
okay.
it's a product that actually helps re-stimulate collagen growth, which is phenomenal.
Yeah. That's interesting.
I mean, everyone pays a lot of money for fillers and have to do it every single year. You can pay the
People
same
do it more
price.
Than once a year.
Correct. The same price for something that will last 3 times as long. It's a no-brainer. So when they first came to me, I'm like, well, why are doctors going to want to carry this when?
Yeah, there's no. What about the repeat business model?
But it's really not the repeat business model. You want to keep happy customers that will do other things also. So you're providing them a service in regards to getting trust and loyalty, and that's what you're building, and that's part of what we're doing.
And they'll come back to you for everything else they need dermatologically. Because I know in Florida, the older we get, the more we're going to the dermatologist. You probably have more repeat patients than any other.
No question about it, because in South Florida, you do have to worry about the sun, and we have a lot of skin cancers, and we do. That's what my bread and butter is in our practice. Mm-hmm. But one of the things that I do in my practice is that I promote quality care and patient-oriented focus. What that means is when people come in the door, they're treated like family. Mm-hmm. And we try to make sure that every single person is treated like family. When you call, you don't get a machine, you don't get an out service. You get actually people that you will know that are in my office all the time.
Yeah, your people are very nice.
And we provide extended hours where we are there early mornings, even Wednesday, late evenings, Saturdays. So we're trying to accommodate everybody.
Okay, so where were you before this? Because I know you're relatively new. That office is brand new, but you were practicing somewhere
I was
else.
in Fort Lauderdale for 11 years, and I
Okay.
built up an extensive good clientele, and a lot of them have followed me. And I'm trying to now also let people know not only where I am, but also to gain new clients. And this quality care, I've been treating people like family, I think is the way to do it. And we're also doing something that no one else does, is we're also going to offer 2 factors. We're going to have a VIP dermatology concierge practice, that we're going to have general dermatology, but also have some VIP care. And what that
exactly
means,
is that?
It means that we're offering some services. One is called teledermatology. Teledermatology means you can actually call your doctor by sending text messages, pictures, any concerns you have, whether it's...
So like if I had a mole, I could take a picture of it.
If you have a suspicious lesion, you can send me a picture with your phone, and you can get me anytime. It could save you from coming in. It could save you from...
So it's like a concierge.
Yes. And also discounted on cosmetic procedures, and also...
So do you price that a fee per year? Is that the way that...
Well, for the people that are part of the VIP concierge practice, this is complimentary. So they get complimentary treatments. Other people who do not, there is a fee, not covered by insurance, for teledermatology.
Oh, I see. Okay. So the idea is they can get a hold of you anytime and...
But there's a lot more perks than that. One of the things I got the idea from was Spa Envy, that provides monthly massages. People can now get monthly facials with my esthetician, and that's part of the packages. What we're also doing is not only do we have a dermatology office, but we're going to build a skincare clinic right next door. And the skincare clinic...
We have a lot of space there, so that's...
A lot of space. Yeah. We have 2,000 extra square feet, and the goal is you come in for your dermatology needs to see me and my staff. We take care of your medical and your cosmetic, or you can go next door and get pampered, any of your facial pampering, as well as, like we were making jokes about sunscreens. You can get even spray tan next door. So we're gonna...
Oh, that's nice.
Yeah, we have a lot of good goals that we're gonna start promoting and building.
It's smart for a dermatologist to spray tans, because the whole idea is you don't want a real tan.
Everyone goes in the sun and wants to get tan, and as a dermatologist, it's a tug of war. I'm fighting them not to, or do it the right way.
So if you can show them that you can look
you can
just
get
like...
a fake tan and look good, just as like...
I love fake tans.
Oh, please.
I don't have one right now, but...
I was telling your girls outside, I said the 2 things that age people the most are the sun and also smoking. And if I can help avoid people from going in the sun, give him a good, healthy alternative,
Yeah, because
I will.
nobody wants to wear a short dress if they're all pasty white. So
Like me, but I'm proud of it. I wear it with a smile.
Okay, so that's interesting. You're doing all that, and then I know you do all the facial injectables.
I do everything. Yes, I do.
Okay. Are you doing that new one that they're using for lip line?
Volubella? Yes.
What's it called?
Volubella.
Volubella. Okay.
You know, there's new ones like Volubella. There's Restylane Silk. These are new, thinner products. Fillers are all based upon how thick they are, how big the void is, how big the deficit, and how much we have to restore or replenish the collagen that's lost.
Okay.
When you're talking about the thin lines around the lip, smoker's lines or kissing lines, whatever way you want to describe it, you want to use a thinner product. This is a thinner product that touches upon those lines and makes it just look a little more relaxed and refreshed. So it's actually a really great product that's thin that you'll never.
Is it only used around the lips, or do they? Can you use it?
Ideally, we're using it in thinner areas. So
What about the little area?
I was
like
about to
right,
say.
Yeah.
So thinner products are really good for like fine lines or wrinkles around the mouth, or even if you want to fill the tear troughs.
It works for that?
Oh yeah, absolutely.
Okay,
and I tend
big.
to do that stuff there too.
Mm-hmm.
A lot of people have like you can see the dark circles around the eyes, and that's actually not necessarily always a dark circle, but it could be a little bit of a crease called a tear trough, and we fill that with a filler.
Yeah.
Yes.
I know women are always. I see women that have a lot of Botox and have no wrinkles, but they still have little wrinkles under the eyes, and they're always going nuts. Do you know anybody that can get rid of these? Does that product work for that?
That product does not. What I would suggest at that time is we tested a product for the eyes we call Bright Eyes. And the reason why we call it does three things that are amazing. It gets rid of the dark circles, it helps with the puffiness, and it also has a retinol in there. Retinol helps with exfoliating the fine lines and wrinkles. So there is a topical cream that we do promote that gets rid of those fine lines and wrinkles around the eyes.
It's a topical cream.
It's a topical cream, yes.
That's interesting.
So no injections, no.
Oh, and it works.
Absolutely.
And what's in it?
Retinol. Retinol is, retinol for the face, but you want to use a lighter retinol for around the eyes.
Yes, yeah.
But it's a combination product that, like I said, it does three different things, not just for the fine lines and wrinkles, but also puffiness and dark circles.
Wow.
I
might have to get some of that.
I actually demoed this on my mother, and I did a study, and it was actually published, and it was actually in a lot of magazines. And
Really?
in my office, when you come in, if you look carefully around my reception area, there's actually a photograph, and it was called My Mother's Eyes. And I did a study of my mother at beginning, at week 4, week 8, and week 12.
So how long does it take?
8 weeks.
8 weeks.
Yes.
That's very interesting.
Yeah.
Okay.
It's amazing. There's a lot of things there's a lot of secrets that people don't realize. So it's not just the eyes can be a giveaway for someone's age, but the hands. The hands are another big one.
Oh yeah, we know all about hands.
And I know that you were talking last time. We had someone who was injecting the veins to shrink them down. I do other things that actually help. I
some
put
people
fillers.
don't have the prominent veins. They just have
Very, very fortunate if they have enough collagen in there. But a lot of times as we get older, we lose the collagen.
Yeah.
So I inject fillers around the veins of the hands to pump up the hands, and I also do laser to actually get rid of the blemishes on top of the hands.
Yeah, what about all of the dark spots?
There's multiple different ways to go with that. There are either topical creams, which are good but slow. They're good but slow, and you're paying less money. But as you pay less money, it takes longer duration. There are chemical peels, which are a little more expensive, but work a little quicker to get rid of the spots.
Okay.
Then there's lasers, and lasers are phenomenal. Cost a little more money, not terrible, and usually 3 treatments to get rid of the blemishes.
But can you get rid of everything?
So that's the catch. A lot of people want to
start. Can you take it back to when we were in our 20s?
I can help. So a lot of things I can do can get rid of, but also there's preventative care. You have to also then be good at wearing sunblocks or
I wear all my
clothing.
sunblocks, and I still see things pop up.
I tend to, when I go in the sun, I wear the sun protective shirts so I don't get, but then I cheat. I use lasers to get rid of any blemishes I get.
Well, you're
the
in the
fortunate
business.
of being in the business, yes.
Whenever they pop up, you can stay on top of it.
100%.
So if someone wanted to do that, like how often would they come in just to get rid of all the
So generally what happens is a lot of times people come in to get rid of the blemishes on the hands. 3 treatments is all it takes, and then they want to, noticing their hands look beautiful, then they want to do their arms.
Can you do with the whole body?
You can do anywhere you want. It's all based upon, lasers they focus on pigmented cells.
So do you have to individually hit each
If you're doing a large surface area, you can cover the whole area. It only works where there's pigment. So for example, if you're doing the whole arm, if you only 4 brown spots, it's going to go to those brown spots and cause those brown spots to peel off, and they disappear.
Let me ask you, is it like a laser that you would hit each spot, or are you talking about just something that goes...
It all depends on each case. Every case is different. I can do a whole large area. If some people have a lot of brown spots, I can get rid of those brown spots, or if people have individual spots, I can target just those. So it's case by case.
Okay.
But the laser only gets absorbed in the pigmented cells in those brown spots.
Okay, so now if you stay on top of this, can you
can really
age
clear up-
without all of the...
The whole point of what everyone's doing with cosmetics is fighting father time. If I tell people, if you can afford not to have crooked teeth, you get braces. If you can afford not to have wrinkles or dark spots, you can do Botox, you can do lasers, you can do fillers to restore the volume that's lost. So there's a million new things, and they keep coming out with the newer things that
Right.
are out there to keep yourself looking younger.
Mm-hmm. So it is possible.
Yeah, you can keep looking good as long as you live. Yeah, absolutely.
Okay. Now you talked about using the Kybella to get rid of other body fat. Do you do liposuction or any other treatments to get rid of body fat?
I've always been taught in medicine, you want to tiptoe into the water. You want to start with least invasive procedures before you get down to invasive procedures. Before you get to surgery, if you can avoid it, that's why everyone's going with the non-invasive cosmetics.
Right, everybody says
Kybella is another option. So instead of actually, when you do lipo is invasive.
Right.
You're inserting something into the skin, where anytime you insert anything into the skin, there's possibilities of infection, there's scarring. So Kybella is a great way to get rid of the fat without having anything introduced into the body that can cause scarring.
It's basically doing the same thing, getting rid of the fat.
That's exactly what you're doing.
Interesting.
Yes.
And you do chemical peels and facial lasers and
Chemical
things like
peels are a very easy way to get rid of damaged skin, sun-damaged skin, brown spots, blemishes, spots that you don't like, and bring healthier skin to the surface. So I do chemical peels. Chemical peels, I explain to people, there's different types in the sense of there's mild, meaning it's not too deep, very minimal downtime, versus moderate and deep. Deep peels, you have a lot of downtime. So I tend to go with what's called a lunchtime peel, which people can come in, they can leave the office. They don't look like, the pizza with the cheese sloughing off.
I've seen
They can go in public,
I've seen that.
and they can achieve the same type of result over a series of peels.
Oh, so you just have to do more of them.
You just do a couple, like when I say a couple, 4 to 6 superficial peels can get you where...
To the same place that one...
Absolutely, with
Oh,
one or
that's
two
good to know.
deep peels without having the downtime means
Right.
you can go back in public.
Right.
And it just looks like a little sunburn. It's not a big deal.
Okay. Very
And
good.
it's really minimally uncomfortable, so it's incredible.
Okay, tell us your address and how people can get a hold of you. Where can they find you? I know you're on social media.
Okay, so yes, we're on social media. You can look under Green Dermatology and Cosmetic Center on Facebook. You can look at drgreenderm.com, I think it is, or greendermatology.com. I'll tell you right now, to be exact. The practice is that new. I apologize. It's kind of embarrassing. I don't know. It's drgreenderm.com.
drgreenderm.com.
We're right off of Hillsborough East and 95. So
Very
we're
convenient location.
very conveniently placed right off of 95 in a medical campus. There's tons of parking. It's
Yep.
a 2-story building. So it's 260 Southwest Natura Avenue. And the number is 954 481-0650. Place is that brand new, and you'll see it looks beautiful. It's a brand new building, and we'll take care of you like your family. So please come and let us help you out.
Okay, thank
Becky,
you very
thank
much.
you so much.
Thank you.
I appreciate it.